Welcome back to Inside Politics. Our guest today, Dr. Alex Jahangir. He's the face and the voice, the presence of behind the city's efforts to try to fight COVID-19 over the past 2.5 years. Doctor, one of the moments when things got most difficult for you, throughout the book you talk about driving in and out to work along 12th Avenue. And one day, I think during the darkest days, maybe when things were first getting shut down and people were having to lose jobs and things like that, you had to pull off the road because emotions just overcame you.
Yeah, you know, I live just south of town, and when I drive up 12 South to go to the Office of Emergency Management, you know, I love driving up 12 South. I spent a lot of time there with my family to go to the ice cream shop, the pizza shop, the park. The day we were going to put our safer at home order in place, people by that point had essentially been staying at home. It was dead. There was no one there, not one person in my whole drive that I see outside. And it just hit me, and it hit me that this thing was going to last longer than a couple of weeks like I had initially thought, and not knowing what the implications of that were for anyone, yeah, it just overwhelmed me.
We talked about the people who've been helpful to you in this. One of us is the fire chief of Nashville, William Swan.
Yeah.
He particularly seemed helpful to you about understanding about leadership, and particularly about how to, if you get criticized, how to handle it and internalize it in a way that doesn't hurt you or destroy you.
Yeah, Chief Swan is honestly one of the strongest leaders I've ever encountered in any realm that I've worked in. And when it comes to that, you know, I think early on especially, I think I had a lot thinner skin than I realized. And Chief Swan said, look, great leaders don't let criticism impact them from serving the public well. And he said, as long as you lead with integrity, admit when you're wrong, like the rest will work itself out. And those are great lessons that Chief Swan has taught me and have come in very handy.
You can't tell the story about COVID-19 in Nashville without the relationship with the state. Early on in the book, you say that Metro and the state work very well together. In fact, you tell a story that I'm not sure I'd heard before, that when Metro was trying to get started just with testing, you wouldn't have gotten started unless the governor intervened and got you the materials you needed.
Yeah, it's, you know, I think that's one people always try to say, oh, the city and the state had so much challenges. When it came to the response and taking care of Nashvillians, I think the partnership with the state, the governor's office, General Brower, the Unified Command, Commissioner Piercy and her team, that story is one of my favorite to tell. We had everything set up for our testing sites that we had in Nissan Stadium and other places. The state had agreed to pay for the tests. And the governor was wondering why it hadn't started. And we went and met with the governor at the Armory, the mayor and I did. And he asked, and we said, look, we don't have the swabs. Literally, the only thing left was the little nasal swabs. And the governor was pretty fired up, and I appreciate him, and he made a phone call to the lab that he was paying for, and he went down to Memphis on his helicopter, put him in the back of his helicopter, and flew back, and that's what started our testing here in Nashville. But
obviously things began to change. When did you first sense that there was some sort of souring in the state and Metro relationship? In the book, you seem to say it was because the governor made a decision to cater more to Donald Trump and his base of voters. Well,
you know, I think the divisiveness across the country, you know, and I think the President Trump, I would say, probably did not help the cause of bringing unity together and moving forward. I think there was the governor probably had a lot of issues that he had to deal with on his side that I'm not privy to. But honestly, anytime Nashville needed something, we kept. You know, they were very supportive. You know, when it came to mask mandates, when it came to safer at home orders, we were always in dialogue. You know, they let us know their position, we let us know our position, and because of the working relationship that we had, I think we were able to always reach a point where we had an understanding of each other, even though we might have disagreed a little bit, and help move forward where we need to get to.
It does seem that there were mixed messages and mistakes made perhaps on both sides of all this. I mean, first, the Center for Disease Control said we don't really need to wear masks, and suddenly it became the central point, particularly to try to combat the disease, particularly before the vaccines got out. I guess we shouldn't be surprised there was confusion and a backlash.
Yeah, you mean across to the CDC and nationally? Yeah, so, you know, I think the leadership need to come from the federal government. I mean, this is a national response. The CDC, and I want to clarify, the CDC then and the CDC now, there's certain things that we could have done better. Data sharing. They could have been better about getting protocols out there. You know, not leaving every municipality to figure out how to test people, how to quarantine people. there needed to be better guidance from a national point early, and we just didn't get that.
So you agree with the Biden administration? They're now trying to look to see what needs to be changed about the CDC and its response to this. It seems some of the things that are going on with monkeypox are repeating some of the same shortcomings the CDC had with COVID.
Yeah, I think the CDC dialogue could be and should be better. And I want to clarify again, it's not just under the Trump administration. If you remember, all of a sudden the CDC under Biden administration said, hey, you know what, no more masks needed, with no warning to the state, no warning to the cities, and everyone had to fend for themselves. Responses to crises evolve, and I think people need to have some level of grace about that, but I think fine-tuning the response is going to be really important for the next thing.
Internal discord also happened within Metro government. You had a health director you just brought on, and a lot of this stayed out of the media, but a lot of it now comes out that you had continuing problems between everybody being on the same page. The health director was one place else and everybody else was someplace else. Was that just not a very good hire?
That was not a good hire. That's right. And and I think, let me clarify, it's maybe not a good hire at that moment, right? I think the director had great credentials, stellar ideas, but sometimes when we're in the middle of a pandemic response, you maybe need a different kind of leader.
As we come towards the end of this, your time, at least for now, is over for public service. Are you interested, after what you went through, the good and the bad, that you want to be involved in public service? And might that be in a political way? Might you seek public office one day?
Yeah, I don't see seeking public office as being in the cards, but I'm always want to help the community in which I grew up in and will continue to live in.
Book's coming out soon. Where can people get it? Can they get it right now and order it sometime?
You can order it right now, Parnassus, Amazon, Barnes & Noble, wherever you prefer.
Dr. Jahangir, thank you so much for being on the program.
Thank you for having me.
And thank you for joining us on Inside Politics. Hope you're back here again for a future show. If you can't get into politics in the meantime, go to the News 5 website. You'll find my Capitol New commentary there. New commentary posted every Friday afternoon. Enjoy the rest of your weekend, and we'll see you here next time. Goodbye.